choices are between an autotransplant, an allotransplant, and an autotransplant is the correct answer. You take it, put it back into yourself, it's called an autotransplant. So these next two are, well, this one's a little tricky. Test of short-term verbal memory is the block tapping test, the Waze digit span test, digit span +1, or paired associate test. Anybody look that up?
Digit span +1 test.
Digit span +1 test, that's correct, yeah. Normally, the digit span test tests, whether you can hang on to about 7 consecutive numbers. But if you have them learn more than one, then you're adding on to it. And if they can hang on to it, then it's a test of their verbal memory. And HM showed no long-term retention on, remember HM had long-term retention, but he wasn't aware of it. He had long-term retention on the mirror drawing test, the rotary pursuit test, incomplete pictures test, and some Pavlovian conditioning tests. But poor old HM had no long-term retention of verbal input. He just, his explicit memory just didn't exist for longer than a very, very short time. So A is the correct answer there. He's got pretty decent implicit memory, which until the last 15 years they weren't aware that he had memory, or they didn't have ways of testing it. Now it's known that he has fairly decent memory, at least implicit memory. Tests used to assess implicit memory in neuropsychological patients are not object recognition tests. Those are explicit memory. Repetition priming tests, episodic tests, delayed non-matching to sample tests, or digit span tests. So that's explicit object recognition and digital. Repetition priming tests, kind of, but the best answer here is think about it. Actually, repetition priming tests, I believe. Let me check that. I think it's repetition priming tests. Delayed non-matching to sample tests are usually used in animals. I believe it's repetition priming tests. Cerebral ischemia. I'll post the answers. I should have reviewed this before I came down here. Cerebral ischemia is a condition characterized by cancerous brain tumors. No. Type of cerebral hemorrhage maybe could cause ischemia. The real answer is a shortage of blood to the brain causes ischemia. It's regardless of the source. It could be cerebral hemorrhage, but that causes other problems besides ischemia. Cerebral ischemia does produce brain damage, and an area of brain damage caused by a toxin is not known as ischemia. It's just a lesion. So the true answer is really a shortage of blood supply to the brain. 15. The medial dorsal nuclei often damaged. In Korsakov's amnesia are nuclei of the what? Hippocampus, hypothalamus, mammillary bodies, cerebellum, or thalamus. Welcome. I just say welcome. And we're just going over last year's exam. We're about halfway through. So any guesses on that? Where we're at? So the medial dorsal nuclei, it's actually part of the thalamus. Mammillary bodies are sometimes involved, but they're not called medial dorsal nuclei. So A is the correct answer here. In the brains of Alzheimer's patients, the level of epinephrine, dopamine, norepinephrine, serotonin, or acetylcholine is greatly reduced. You guys are very talkative here. You wanting me to give you all the answers, or you just want the answers? Well, the correct answer is acetylcholine. And that's because in the basal forebrain, the area of the basal forebrain actually projects to many areas of the brain, and the neurons from this area contain acetylcholine, and in a lot of different areas of the brain, the content of acetylcholine is gone because of the basal forebrain area neurons that would be going out there have disappeared. So acetylcholine levels are low globally relative to normals in Alzheimer's. Yes. Did you have a question?
No.
No?
As is you.
Okay, so this, this is the last year's exam we're going over right now. So question 17. Amnesia is produced by a blow to the head that does not penetrate the skull. It is called, well, this is a closed head injury because it didn't penetrate the skull. Could be a concussion, but we're talking about the amnesia here. So what would be a good descriptor of the amnesia that comes after getting whacked on the head? Post-traumatic. That's correct. That's the correct answer. Which of the following has been used extensively in the assessment of object recognition memory in monkeys? Well, we don't put monkeys in a radial arm maze. They tear it apart. They find it. Pardon me?
Is it the radial arm maze?
It is the radial arm maze, yeah. No, it's radial arm. It's not the radial arm maze, sorry. We were talking about radial arm maze. No. For object recognition memory in monkeys.
Delayed
Object, yes, delayed non-matching to sample task. Right. Yeah, radial arm maze can be used for spatial location memory and working memory in rats, but not for anything else. Rats or mice, pretty well. Human medial temporal lobes include the rhinal cortex in the temporal lobe, the amygdala in the temporal lobe. We're pretty sure the hippocampus is in the temporal lobe, right? And what's a part of the hippocampus? CA1 subfield. So these two, for sure. What's found in front of the hippocampus? Well, yeah, but it's medial to. The amygdala is actually situated right on the front end of the hippocampus in both of the temporal lobes. And the rhinal cortex is that area just outside the hippocampus that was destroyed in rats that showed object recognition memory errors in this delayed non-matching to sample task that we had the Mumby box that Dr. Pennell and Mumby used to test for explicit memory in the rats. So all of those are part of the medial temporal lobe. So E is the correct answer for 19. Rats can perform the delayed non-matching to sample task only at chance levels, wrong, at levels that are only slightly above chance, same thing, at levels that are not significantly above chance. I gave this one away. Almost as well as monkeys at retention delays up to a minute or so. They can't do it as well as humans, but they are